Alright, everybody, welcome back. Today we have a new medical video, and now I was gonna upload the other two I had planned today, but this is gonna be my first brand new medical video added to the channel. I haven't uploaded a medical video since 2022 in December or November. I did one of my last videos for health conditions. I'm sorry, I do that thing with my head because my head hurts and it's the only way it calms the headache down. It's a tension headache. And they were going to talking about 5 most dangerous health conditions ranked less to most dangerous. Now, what this means is I'm actually pretty excited for today's video because I've been wanting to make this. Now, I'm going to get a lot of backlash because for some people, you guys may not agree that, oh, this is worse than this one, or this one is worse than this one, and I completely understand that. I completely understand. So I just want you guys to know I'm going to be interrupted in the middle of the video to get my anxiety medication, so you guys will be able to see that. So I'm excited to finally do this video for you guys. Please subscribe, everybody. Let's do this. Come on. Alright. Dehydration is number 5. Dehydration occurs as a result of abnormal water loss from the body. Causes are vomiting and diarrhea, especially in infants and children, drugs that increase urination, exertion, whatever, excessive sweating, particularly with prolonged exertion, so like running too much, decreased water intake, burns, and heat. Because if you lose burns, will make you lose plasma, which is kind of like fluids. And when you lose that, it can sometimes cause shock. Heat, which when you're outside in the heat, it depends on how hot it is. If it's like 70, 80 degrees, the chances of you actually getting a medical condition known as heat stroke is very slim to nothing. I just want you guys to know, like heat strokes are real, but you're not always promised to get that. Symptoms are thirst, tiredness, dizziness, lightheadedness, muscle cramps, dry mouth, less urine, urine that's dark yellow or even light brown in color, headache, dry skin or tongue, fainting, confusion, fast heart rate, and breathing. So, just drink fluids is all I'm trying to say. Don't drink too much and cause yourself to go into, don't cause yourself to go into overhydration and you end up killing yourself by drinking too much water. Don't do that. So what I do whenever I'm out, whenever I'm running around and there's water where I'm at, is I take my time. I don't like just gulp one bottle down, go get another, gulp that one down. I take my time on the first one so I don't have too much water. All of these, if you have all these symptoms together, you could have dehydration, yada 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 yada. Severe cases of symptoms are of dehydration, seizures, coma, and death. And hypovolemic shock, which happens when you lose too much fluids known as plasma or fluids such as water. 4 is meningitis, an infection of the meninges, protective tissue of the brain that causes stiff neck, headache, and fever. Urgent medical attention is usually recommended by health providers. If you do not get help from meningitis and no one actually takes you to the hospital, even if they see you having a seizure, is so goddamn stupid, I don't know. Headache with nausea or vomiting, so that could be like a migraine, but in this case, it could be meningitis. That's also if they have a stiff neck or fever. I would not waste any time. I'd go to the hospital immediately because it's only the right thing to do. Decreased appetite, confusion or difficulty concentrating, sudden fever.
I think this turned out pretty good. There's still a couple more today.
I know I am. Hold on. So, sudden fever, that's a big no-no for it. That's a big yes for meningitis. Meningitis can come with sudden fever. So, one thing you need to know about meningitis, it's not something that comes on gradually, like where it, acts like that. I mean, it could, but most cases it will come on suddenly, and your child will just suddenly act different. Sudden headache that seems different than normal is also a sign. So severe headache that seems different than normal, that means like it's a headache that's severe that they never usually can describe the feeling, and it's like a little bit weirder than any of their other headaches that they've had. Seizures are also another sign. So that could be tectonic seizure, absent seizures, any seizures really. Sensitivity to light. So if they have, like, if you look and they cannot take any light at all, it hurts their head that much, it's a sign of either a migraine, most likely a migraine. But if they have any of these other symptoms, plus a stiff neck and sudden fever, it is most likely meningitis.
Come on, Adam.
I'm right here. Hurry up.
Oh, it stinks.
Be quiet. Alright, got my medicine. So sleepiness. So sleepiness is also another symptom. Sleepiness is a sign where you're just basically tired no matter what you do. You can't get any of your daily exercise in because you are that tired. You can't do anything because you are so exhausted you can't even like count. Letter 3, I don't know what that means. I think it's confusion. I don't know. Meningitis is the most commonly caused by bacterial and viral infection. So it could be a bacterial infection that wasn't yet inside that brain that can travel its way up into the brain. So if that's the case, it could be from the stomach up to your brain. Most likely can be caused by brain, like any bacterial stuff you get. If you like get it in your ears, you swallow it, can sometimes travel to your brain. But another thing that can cause it, which you guys may think is a little bit impossible, it's known as it's like a really bad. It's known as an ear infection. Can also cause it because that's a bacterial infection, or it could be a viral infection of any kind. Could cause meningitis because although it doesn't already start at the brain, it doesn't mean it's not meningitis. Meningitis doesn't always have to start at the brain. Okay, it doesn't always have to be. It doesn't always have to be caused by being in the brain. It can travel from any of the body parts and travel up to your brain. So it can start from your stomach up to your brain. So it's anywhere. The infection can be anywhere, and it can sometimes travel to your brain, leading to meningitis. And viral meningitis is caused by enterovirus, so class viruses. So enterovirus is like Coxsackie viruses, echoviruses, other type of viruses which cause meningitis include West Nile virus, influenza. So influenza is also known as the flu. So the flu is one of those interesting ones because they say flu can be really deadly at times, but also it could be deadly at times and not deadly at times. It depends on your immune system. If you have like a really bad immune system and you get like the flu, most cases it won't get too bad, but there is that one possibility it could lead to meningitis. And that's not a good road you want to go down because of how bad your brain will hurt, how bad of a seizures you're going to have. Like, it is terrible. So, yeah. HIV is another one that can cause meningitis. We're not going to talk about what that is because I should not know that, but sadly I do. So we're not going to talk about that. Herpes. I'm not going to talk about that either. Etc. Most viral meningitis resolves without specific treatment. Bacterial meningitis is caused by a bacterial infection. This is contagious and deadly. Most common types of bacterial species that causes bacterial meningitis are Streptococcus pneumonia, causes pneumococcal meningitis. So this is also known as like the strep throat can also cause meningitis. Ammonia can cause meningitis. Nesro meningitis caused by meningococcal meningitis. Listeria, monoclonal bacterial meningitis can spread through coughing, sneezing, and sharing utensils. Spread can be prevented by coughing, mouth while coughing and sneezing, avoiding contact with sick people, particularly if you have an immune system problem. For example, due to medication or chemotherapy is strongly recommended. So chemotherapy is usually used, it's always used, or most likely, always used whenever you have cancer. And whenever you use chemotherapy, yes, it keeps your, it helps you get rid of your cancer, but yet it also destroys all the vaccines you've gotten before that. So it kind of destroys your immune system. So you're not safer than what you were before. You're less safe because you can basically, although it helps you get rid of your cancer, you can still get many health problems because although yes, you do take your medicine with it. You do take, you have this. I mean, it's always a possibility you will get meningitis. Okay, if you have cancer, because again, when you have cancer, meningitis is a very concerning thing because your immune system is compromised, so therefore it means anything can enter your bloodstream, enter your system, and you wouldn't basically have any protection over it. Because what vaccines do is they protect you from the viruses that it is supposed to protect you from. So the flu shot protects you from the flu, the meningitis shot protects you from meningitis, so there are shots for meningitis to keep you from getting that because those specifically will fight it from happening. So it will fight the bacteria from actually causing meningitis. So you would just have to get your shots for all the things that you can get a shot for. So you can get a COVID-19 vaccine, which will protect you from COVID-19. Now, no, these vaccines aren't going to keep you from getting it all in general, but it can. But the possibility of you getting it is very slim when you don't have chemotherapy. Chemotherapy for cancer it's a big no-no for I think many people when it comes to immune systems, because although chemotherapy will help your cancer, it will also cause you to get many other problems such as death, because it can cause so many viruses and diseases to enter your bloodstream, enter your body itself. So I would not recommend wishing for cancer. Now, it's not something you're gonna automatically, it's not something you're gonna wish for. I hope not, but who knows? Another thing is, the risk factors include age. Children below 5 years are more prone to develop viral meningitis. Bacterial meningitis are common in below 20 years of age. Pregnancy. So pregnancy is another symptom of, not a symptom, it's another cause of meningitis because, sometimes your immune system isn't really that great when you have pregnancy. But a weakened immune system is also one. A big deal about immune systems is they protect you from viruses. We talked about it. They protect you from viruses. They help you fight the viruses that enter your body. And if you have a weakened one, it doesn't really do its job as great as what a normal immune system would do. But skipping vaccines, I'm not saying skipping vaccinations is not good because there are those side effects that you could possibly get. I know it stops you from getting it, but I have to say, please, somebody hear me out. You gotta get some of your vaccines, because if you don't, you could get any of those things at any time without any protection from them, which means if they come into your blood or they come into your system, the possibility of them spreading to other body parts such as sepsis is very high. Meningitis, even more high. I'm just stating a fact. Although this is very rare to get, fewer than 1,000 cases per year, it's still very likely you will have it. Meningitis recovery time. Your provider will work with you to develop a care plan that may include one or more of these treatment options. Malnutrition recovers within 2 weeks. Medication and therapies are necessary for severe cases. Bacterial fungal meningitis is frequently life-threatening and requires urgent diagnosis and treatment. So make sure to get help if you think you have meningitis, because that could just save your life by going there. Although you might think half of it's this, half it's that. Medicine used for meningitis is antibiotics. Bacterial meningitis is treated with antivenomous antibiotics. Cafexime, I don't even know how you pronounce it. Antifungals used to treat fungal infections. All these things down here. Antivirals. Antivirals can be prescribed by doctor. Antihistamine. All these things. Castroloids, whatever those are. Non-infectious type of meningitis. Prednisone, trimazone, methylprednisolone, whatever it is. 3 is thyroid storm, a life-threatening complication associated with untreated or undertreated hyperthyroidism. It causes rapid heartbeat, aka tachycardia, high fever, and unconsciousness. Urgent medical attention is usually recommended by healthcare providers. Anytime you have this, it's an automatic go to the hospital because thyroid storm is just dangerous in a matter of minutes if it's untreated. May be dangerous or life-threatening, extremely rare, fewer than 1,000 cases per year in the U.S. I'm just pointing that out there. It's extremely rare to get this. The chances of you actually, hyperthyroidism is pretty common in kids and other people, but you can get this, but it's very rare. My breath stinks bad. Could have immune system. Alright. Lightheaded. Okay. Fuzzy. Vision is fuzzy. Alright. Tachycardia. 140 heartbeat per minute. Now, this isn't the highest it can go. It can go up to 200 with thyroid storm. High fever. Sweating persistently. Shaking. Agitation. Shaking like your hands shaking. Agitation means you're mad all the time. Anything will set you off. Restlessness, confusion, diarrhea, and or vomiting. Now, already right there, you can tell you're going to get dehydrated with this. You get tachycardia, already makes you sweat like heck. High fever makes you sweat when you got a fever. Sweating persistently gives you also it more. Diarrhea and vomiting even gets you more losing fluid. So there, you're losing fluid from tachycardia, high fever, sweating, diarrhea and vomiting, loss of consciousness. The causes include damage to the thyroid gland, severe untreated hyperthyroidism, overreactive thyroid gland, which is untreated, infection, which is related to hyperthyroidism causing ailments such as Graves' disease. Risk factors for occurrence of this condition in people with hyperthyroidism include surgery, trauma, stroke, diabetic ketoacidosis, pulmonary embolism, and 2 is sepsis. It's an infection that overwhelms the body's immune system, and if an infection enters the bloodstream, causing an infection in the whole body. Sepsis symptoms: generalized body swelling, faster heart rate, reduced urine output, fever and chills, decrease in platelet count, difficulty in breathing, mental confusion, hyperventilation, hyperthermia, temperature of 104 to 109 degrees, hypothermia, temperature of 94 to 80 degrees. So already right there, hyperthermia and hypothermia are two entirely worst things ever, because right there, hypothermia means your temperature is below. Hyper means it's very, very high. So it is very dangerous because if it goes untreated, it can even cause seizures, death, and it can cause multi-organ failure. So it takes a matter of hours. If you have sepsis, you can tell you're sweating. But then you can go into sepsis shock, which can cause multi-organ failure. It means your liver shuts down, your organs shut down, everything shuts down in a matter of just a couple of minutes. Sepsis causes. The causes of sepsis: bacterial, viral, or fungal infection. The risk factors include weak immune system, having diabetes or cirrhosis, wounds or infections such as burns. So getting cuts could get infected. That infection can sometimes go into the bloodstream, which can cause a whole infection around the body, and then can go to the organs, causing multi-organ failure. Sepsis diagnosis: blood tests. Blood samples are tested for infections, clotting, oxygen availability, electrolytes imbalance, and liver or kidney function. Urine test done to check for urinary tract infection. Wound culture test to find out the suitable antibiotics that work best. Sputum culture test to determine the types of germ causing the infection. X-ray to check for infection in the lungs, magnetic resonance imaging (MRI) to identify soft tissue infection, CT scan, CT of the abdomen to check for infection in the appendix, pancreas, or bowel area, ultrasound to check for infection in the gallbladder or ovaries. Number 1, most dangerous is heart attack. Damage to the heart muscle caused by a loss of blood supply due to blocks in the arteries. Symptoms of heart attack: discomfort in the chest region, pressure or tightness in the chest, pain or discomfort in the arm, back, or neck region, usually on the left side, excessive sweating, shortness of breath, either on exertion or at rest, nausea, vomiting, and dizziness. Causes of heart attack: the heart attack occurs one or more coronary arteries get blocked. Over time, a coronary artery can narrow due to the blood buildup of various substances, including cholesterol. Cholesterol? I don't know if that's how you say it. This condition is called coronary artery disease, CAD. During a heart attack, one of these plaques can rupture and spill cholesterol and other substances into the bloodstream. A blood clot forms at the site of the rupture. Bigger clots can completely block the blood flow of the blood through the coronary artery. Factors associated with increased risk of heart attack include age. Increase in age weakens the heart muscles or build up of plaques. Age, okay. High cholesterol levels, diabetes, genetics, family history increases the risk. Heart surgery, high blood pressure, obesity, consumption of tobacco in any form, either chewable or smoked, extreme stress. Thanks for watching, everybody. I hope you enjoyed today's video. If you liked it, give it a thumbs up, and I'll see you on the next one. Make sure to stay safe.